Karim, this is your first time at RSNA for yourself personally and for your company, Mendel AI. Tell me a little bit more and tell our audience, what is Mendel Brain? What is Mendel AI? Mendel AI
is it's an AI engine that allows you to organize data into electronic medical records. What that means is if you want to search for all triple-negative breast cancer patients in your hospital system, it is a tedious process. It requires a lot of human sifting through a lot of scanned documents, a lot of doctor notes to figure out those triple-negative breast cancer patients. What we do is we allow you to do that in milliseconds. Another way to think of it, think of having like an army of human abstractors abstracting all the data in your EMR and making it queryable for you. That's exactly what we do, but we replace the human abstraction with AI, so it's a more automatic process.
Tell me about the onerous process as it exists today in healthcare.
Like the current process?
Correct.
How people would do it?
Yes.
So there's two ways. One way is you basically get, as I said, human abstractors to abstract the data that you have into your EMR system. You basically publish it on a big database or something like that. The other way is you actually depend on research coordinators or nurses to sift manually through the records. 70% of the data today, clinical data in an EMR system, are actually scanned documents. It's not even like a billing code or even a free text note. It's more of a scanned fax from one hospital to the other, or a pathology report or something like that.
How long does it take? So it sounds like it's a tedious process that takes weeks, months, and that process can be short-circuited to how many minutes, seconds?
That's a very good question. So it really depends on how complex the query is. So when we usually go to a hospital system and we try to demo our product, they're usually taking our technology with a grain of salt, right? Like it's another AI company. So what we usually ask them to do is tell us something that took you a long time. So for instance, if you want to search for GRAS colon cancer patients, right? A nurse sometimes would take around 8 hours to find this out. We can usually, we do that in milliseconds. But now if you're searching for something more complex, say you have a clinical trial and you have a bunch of inclusion and exclusion criteria, and you're continuously searching for patients. In some cases that may take weeks or even months, and what we do is we skim that into a few minutes. So something interesting that we have done is we ran an experiment where we compared the AI versus research coordinators on 4 trials. So we picked 4 trials. We got the nurses worked on these trials retrospective, like in the past, so they did not know that they would be compared with AI. We took the results and we ran our AI on the same exact trials. What took them 250 days to do, we were able to do in 9 minutes. Someone may ask, why 9? Why not milliseconds? Why not 1 minute? So at Mendel, we believe that the best outcome that you can get from AI in healthcare is the combination of both the human intuition and the machine precision. What that means is every time we make a recommendation, we have an in-house team of clinical experts that review that, make sure that it is well validated and it's clinically sound before we push it to the hospital side. So that's why it takes a little bit more than just a few seconds.
Let's talk about some of the practical use cases that a hospital customer can use Mendel AI and apply it. You hear a lot of hype, right? So how can they use it in a very practical way?
It's a great question. The best way I think of it, it's an augmentation tool. It's not a replacement tool by any means. So they can always look at it, the way you use Siri, the way you use Google Maps, it doesn't drive your car, right? It just augments your decision making. AI is the same exact thing. Some of the very popular use cases that we see are one, clinical trial matching, of course. So clinical trials in oncology is a big deal, and finding patients is not an easy process. So a lot of our customers use us for clinical trial matching. We see some of them now using it in very interesting use cases, like running feasibility studies. So if they have a trial coming in, before they even say yes or no for it, they run a quick prediction study, seeing whether they already have patients for it or not. We also see a lot of PIs using it for research purposes, like running comparative analysis, seeing how some of their patients are responding to drug X versus to drug Y. Because if you think of it, We're basically taking all your data, making it queryable in a very straightforward way. So now you can ask a lot of questions. The sky's the limit, right? You can ask any question and we're able to answer it based on the data that you have in your EMR.
Talk about the strategic partnership with LifeImage. Why does it make sense?
Definitely. So think of us, and this may be an extreme example, but if you think of us as a gun, it's useless unless you have the bullets, right? And in our case, the bullets are the data. Unless you have EMR data, your AI is useless. It doesn't mean anything. It's just some algorithms that's sitting in the cloud. And getting hospital systems to share data with you is a very tedious process. It's not standard. It takes forever, and then with every site, you have to sit down and figure out a way to do it. Now you come and you find a company like LifeImage, which kind of did an insanely good job making this process more of a standard and sitting already existing behind the firewalls of hundreds and even thousands of hospitals. And that just makes tons of sense, right? Now you have only one company to integrate with, and it can allow you and allow their clients to access the AI system. So I see it as a very, very win-win situation. The customers of LifeImage now can enjoy AI by a click of a button. They don't have to go through any integration process, right? LifeImage now can offer their clients more than just transactions of data. They're becoming more of like an app store, if you think of it, for applications. And for Mendel, that one helps us train our AI faster than ever. Two, it allows us to get access to our clients faster and in a more seamless way.
What are the bottom line benefits for hospital customers?
That's a very interesting question. I would say there is a couple of things here. One is decreasing overhead when it comes to clinical trials. So today you find every hospital has a limit for how many trials they can get because it's a human process, right? It takes forever. Now they can get way more trials without having to hire more people. They're not going to have to let go of, again, it's an augmentation tool. So rather than getting 20 trials a year, now you can get 40, 50, because the AI is going to like augment your existing team. So that's one thing. Two, it actually generates tons of revenue for the hospital. I mean, finding one cancer patient today that is eligible for a trial is a very profitable source of income for any hospital. Sponsors are competing to find those patients, right? But finding again this patient is like finding a needle in a haystack. Now with the AI system, not only are you finding more patients, but you're finding them in less time, building a better reputation with the sponsors, getting more trials, and again, doing all of that without having to increase your overhead. So you're not increasing the cost, you're increasing your revenue, and at the same time, your patients are not gonna have to go out looking for trials, because you're offering as many trials as possible for them, and you're keeping your patients in-house.
We spent a lot of time talking about practical matters in healthcare and AI. Let's talk about the mission, the vision. We're all in this, right, to help change healthcare in some way. So talk about Mendel's vision and mission, and together, as stakeholders coming together, how powerful that combination is.
Definitely. If you look at it, so I used to be a physician. I am a physician. I don't think I can see I used to be. I think I'm just practicing medicine in a different way today, coming it from the tech angle. And every industry comes to a point where things change forever, and you look back and you start laughing. In a sense of, I think we look back now laughing on how we never had cars before, right? How could you move from one city to the other? Medicine didn't have yet this kind of dramatic change, especially in clinical trials. And I think in the next few years, next maybe 5 to 10 years, we're going to look back and say, wow, we used to use patients in trials. I think using AI combined with data coming from companies like LifeImage, you can run what we call patientless trials. You can basically build avatars of patients from the data that you are collecting, and you can run the trial virtually on them. Now, at least phase 1 and phase 2. So now you get faster results. You don't have to go through the process of recruiting patients, and you're actually getting faster to the market. That's one application or one way of looking at it. Other is, even with traditional clinical trials, I also don't think that we're going to go anywhere. I mean, it's going to stay for a while. Waiting 7 years on a trial to get done is crazy, right? Patients are not going to wait 7 years. So how can you do that faster? The way we do it today is you give the trial to the site, and the site has to start recruiting patients. But what if we do that in the opposite way? What if sites who have patients already eligible for a trial, they just raise their hands and say, hey, I have a patient for that trial. So the trial comes to the site when the patient is already there, rather than the opposite, right? I look at it as a more proactive approach rather than a reactive approach. And if you can shorten the time of clinical trials, you have tons of patients waiting for those drugs. I had an interview with a journalist. She was from East Europe. And during the interview, she started crying, and I was like, what's going on? And then she said, look, I've never ever heard about targeted therapies. I was discussing targeted therapies in clinical trials. And she said, I don't know why. I said, because simply most of it are not out of clinical trials. It's not available in the market, right? And the fact that the patient cannot access something that can save his or her life just because it's still in a clinical trial is a very sad thing that we need to change.
And final question is an open question. Anything that you want to convey, some thoughts that I haven't asked you about? Any final thoughts?
I think one of the friction points we usually have is people tend to think of AI as this evil creature, right? If you actually Google AI, Google image AI, you're going to find all those like bionic human beings and bionic arms and stuff like that. It's actually kind of the experience or the way we portray AI, I think is not fair. And people in healthcare have to embrace AI with a different approach. And what I mean with that, they have to look at AI as an augmentation tool. It's not something to replace them. Two, they have to have some very basic understanding of how to judge a good AI versus bad AI. We know about big companies that have failed their promises, and that's kind of caused a big, people are taking it with a grain of salt, but yet, it's like when you're buying a phone. You know how to pick like a good phone versus a bad phone. You also have to understand some basics around AI before you make your contract or before you pick your vendor. And if you do that, AI is going to change your practice. It's going to be more profitable, patients are going to be happier, and you're going to reduce the cost dramatically. It's just all about picking the right vendor and the right fit for your hospital.
Thank you.
Thank you so much.